Good afternoon to everyone. Today is the 43rd part of the empowering session for students, Conceptual Toothing Edge 2.0, which is conducted under the leadership of Ifph. And today we have Dr. Vinod Joseph as our chief guest. Sir is going to give his valuable lecture on the topic, how to become effective in choosing Similimum. As usual, the top heads of the IFPH, other experts in the field of homeopathy are also taking part in this discussion. So let us actively participate in this meeting and try to make this success. So I now invite Priyadarshini to deliver the welcome speech.
Okay, thank you, Roy. A very good afternoon to all. So today we are in the 43rd session of our Conceptual Toothing Edge 2.0. So today we have Dr. Vinod Joseph as our resource person. Dr. Vinod is trained under Professor George Vitolkas at IACH Greece. He is a faculty of Indian Homeomedical Association. He is a director and chief consultant at Dr. Vinod's Homeopathic Healthcare and academic for classical homeopathy, Kakanad, Kochi. And it's our pleasure to welcome you, sir, to our students program. And we are so eager to hear from you on the topic, how to become effective in choosing Similimum. So I welcome everyone to this webinar session. And it's, sir, welcome, sir.
Okay, so very good evening, very good afternoon to all of you, the aspiring homeopaths or budding homeopaths. And I'm really thankful for the organizers to giving me a chance to speak to these young promising homeopaths. So I feel really glad to speak before you about such a topic. Actually, I asked the organizers about whether they have any preferences for the topic or not. So they gave me a few topics, and I'm glad to hear that you people really wish to have a crack on how to become successful in selecting homeopathic simile. That means that I presume that you people are following correct Hahnemannian homeopathy, because then only the aspect of Similimum happens. Otherwise, we are just throwing out remedies. There is no need to find out any particular Similimum or not. So as we all know, this is the cardinal or basic principle of homeopathy. And as the picture shows, it is the Similimum that matters. So it is the bullseye, the Similimum that matters. So how to achieve the target? So that is our topic of discussion. So in today's world of, or rather homeopathic world, we actually come across so much of teachings, so much of practical experiences, and the students usually will fall confused. So why? Because I think this picture will give you the answer. This is the current state of homeopathy or a homeopathic case. So it is actually one's perception or how they perceive a thing that actually makes things easy or difficult. But in actuality, in homeopathy or in a case, there is only one Similimum, though people perceive it differently. So that is how homeopathy becomes unique, and that is how homeopathy is considered as one of the difficult modalities to practice. If you look into this picture, each one of us might point out different aspects. But in conclusion, we have to arrive at a single point or a conclusion. So what are the basic requisites for a proper knowledge, or how to become a good practitioner who can select the best homeopathic medicine for the patient? So the basic requisites. So I'm not talking in terms of your theory that you have undergone during your course studies. Instead, I'm talking from a practical viewpoint, how far you need to actually implement the knowledge that you have gained in your theory part and during your college days in actual practice to become a successful homeopath. So the basic requisites, as we all know, is number one, the assessment of the patient. See, we usually think about achieving Similimum means the knowledge of a drug or knowledge of medicine. But that is not always the case, because the cases are different and the people throughout. I'm not that aware whether you people are into your clinical sessions or not. Actually, if you have met patients, then the actual scenario is little different. So we need a proper patient assessment. What do you mean by patient assessment? That means different people come with different states of health. And people with different state of health can throw out different symptomatology, and the clarity of symptomatology will be different in different cases based on the health of the person. If you get a clear symptomatology, that means you will be able to find out the correct medicine much easily. Or rather, I would like to say that if all the symptoms or majority of the symptoms point towards one single remedy, then the choice is easy. But unfortunately, this is not the case. You start looking into the case with a prejudice that this can be this medicine. Unfortunately, you won't find any symptomatology. Then comes something different. So why this happens? This is because day by day, the health of the person or health of our society is going low. So a normal healthy person can throw out the correct symptoms or good, correct, clear symptoms. But an unhealthy person won't be able to throw out a correct symptom. See, what do you mean by symptom? A symptom for a homeopath is much different than the symptom for a modern medicine practitioner. So that we will come into later. And second one is homeopathic understanding of the case. So this is an important aspect. As we all know, we usually study cases in the name of pathology. Yeah, this is a case of psoriasis. This is a case of vitiligo. This is the case of asthma. This is the case of eczema, etc., etc. But actually, that is not the correct way of homeopathic understanding of the case. If you say that this case is a Similimum case, this is an arsenic amalgam case, then the homeopathic aspect is a bit more clear. And above all and above these things, the understanding of the case. That means whether the case is a simple case or is it a difficult one, or is it manageable with one single remedy, or we need a sequence of correct prescriptions. So these things depend on how knowledgeable you are about the theoretical part of the homeopathic approach. Then next comes the application of materia medica and repertory. So my dear students, the application of materia medica and repertory is only one part of the journey. I have seen many students or doctors who are really well versed in materia medica. I have seen people who can literally tell all the symptoms listed in the Allen's keynotes, and yet they struggle to find out that particular remedy when it is indicated in a case. Why? It's all because of the improper understanding, or people doesn't know when they are out of the colleges how to actually apply homeopathy. So what is our target? In any case, our aim is to perceive without any bias a remedy picture from the available data. So this is our target. We get a lot of symptoms before us. The patients will tell us a few symptoms, and we by our observation will get few symptoms. Then the relatives will give us a few data. Then we have all the investigations, all the history and the family history, and lots of data. And what is our target? Our target is to perceive without any bias. So this is an important aspect. Here in a case of eczema, you should not be prepared to give a sulfur, because yeah, sulfur can be indicated in eczema, but sulfur is one among many medicines to give. So without any bias, you have to approach a case. Then we will be able to perceive the remedy without much confusion. So what shall we do? In classical homeopathy or in Hahnemannian homeopathy, we depend on peculiar uncommon symptoms. So that is our target. The patient might come with fever and they will elaborate that I have gone to this doctor, that doctor, and they have given me this medicine, that medicine. These are rubbish. It is no way going to give you any lead towards the remedy. Instead, we have to look into the peculiarities of the patient that makes that individual stand out from the others. So we have to look for peculiars in the presenting complaints. For example, I will tell you, if suppose a patient comes to you and says that I'm feeling difficulty in breathing. So that is a common symptom. If you find that the person is drenching with sweat during that episode of dyspnea, that is a highly peculiar thing. And that points towards a few remedies. One of them is sambucus. The other one are tuberculinum, arsenicum album, and carbovegetables. So these are the things to be looked into. I'm just citing you an example how to approach cases. Always, these are simple things. We all learn that we have to look into striking uncommon peculiar symptoms. But fortunately or unfortunately, we will forget that when we actually see the case, and we are biased and we go for the pathology. A fever, give this medicine, this combination, and move ahead. No, this is not homeopathy. Then look for peculiars or any peculiarity, if available, in the history of the case. How history becomes important. I will give you a few examples. If the person's history has, I recently met with the case of psoriasis, I think, and on inquiry, I found that this particular person has the history of undescended testes. So I was actually thinking in terms of aurum metallicum, and this history of undescended testes gave me another confirmation to give aurum metallicum. See, I was actually struggling to find out whether I should give tuberculinum or medullum, and then the person said that he had a history of primary complex in the infancy, so that made the choice easier for me. Now, or else, if we come across a history of that means a history of eczema where the presentation actually were on the flexors, that means that on the bends of the joints, that again suggests the possibility of psoriasis. So likewise, the history of the person, the illnesses through which he has traveled, usually suggest us the indication of the remedy. Then look into the peculiar things in the generals. This is the most important aspect. The general symptoms, the appetite, thirst, bowel movements, general energy levels, sleep, and in females, the periods, menses. We will get a lot of peculiarities, desires and aversions, thermals, where we can differentiate it. And then comes the psychological essence. And I would like to warn you, see, if someone says that in classical homeopathy, people rely on the mental emotional features more, and you people start to read Vithulka's essences, then in each and every case, you will find a remedy that you have read. Based on the mental emotional picture, based on the psychological features, it is easy for you to get into a remedy picture. But the chances of failures will be more, because the psychological essence means the pathological deviation into a psychological state. So I will explain it further. You know that Arsenicum album is a fastidious person. By the knowledge that if you come across a person who is really clean and neat, and jumping into a conclusion that he requires Arsenicum album, you may end up in a wrong prescription, because the reason by which Arsenicum album becomes fastidious need to be understood there. Why? Why Arsenicum album needs to be fastidious? We can come across many fastidious remedies like Arsenicum album, Nux vomica, carcinosinum, and even sulfur. You might be amused by the word sulfur, right? See, if you find the reason behind the fastidiousness of each and every remedies, then the things will be much easier. So we have to learn materia medica by understanding the symptom properly. When we come across a stage, when we come across a symptomatology, a symptom, just ask the question, why? If you come across a person who is really neat and tidy, ask the question, why? Why is he fastidious? If you come across a person who is really sad, just ask the question, why is he sad? Then this answer for the question will lead you to the remedy. Arsenicum album is fastidious just because of his insecurity regarding health. He is really afraid that if the things are not kept clean, tidy and well, he might come across something which may affect his health. So ultimately, the fear of death is giving him the problem. That is why he is overly fastidious, overly cleaning. So this is the reason of Arsenicum album's fastidious. And if this is not the reason for the person who is in front of you, then you will lose the case. And what about Nux vomica? For Nux vomica, it is basically Nux vomicas are very hardworking and ambitious. They need to be done, need the things to be done in a perfect manner. They are perfectionists. So that quality of theirs makes them clean and tidy. It is not the anxiety of becoming diseased. So what makes Natrum muriaticum fastidious? Natrum muriaticums are fastidious in the aspect of time, management of time. They are very particular because they are very sensitive. They cannot bear the thought the other person getting disturbed by them. So they are on time. So they need things to be done in a correct manner. So that is why they are fastidious. Why carcinosinum is fastidious? Because carcinosins are highly sensitive to reprimands. So if things are not kept clear and clean, if someone reprimands them, they cannot tolerate. So likewise, for each and every symptomatology you come across, just put a tag of question mark after the impression that you get. Then if you get a correct answer for the question, and if that matches with the drug you are thinking about, then the choice of the medicine is more appropriate. So this is how to deal with the psychological essence. And then comes the combination of symptoms. In some cases, the combination of symptoms might give you great indication for Similimum. For example, if you have a great sensitivity to sun, and if you have great sensitivity of the stomach, along with that, if you have a great sensitivity to milk, aversion to milk or aggravation by milk, this makes a perfect combination for Natrum carbonicum. Likewise, you might come across many other remedies. I'm not going into each and everything because the topic itself is a huge one. So I'm just giving you light for few things. So we have to understand what actually homeopathy is. By the application of homeopathic remedy, we are actually stimulating the immune process to cure illnesses. So these are the words by Professor Vithoulkas. Homeopathy is a highly systematic method of powerfully stimulating the body's immune mechanism to cure illness. So by producing the similar symptoms, see, since you are students, I would like to explain it a little further. For a practical purpose, we will think about a case who is reporting to you with fever. And actually, what is a fever? A bacterial fever. So when a bacteria approaches you, the body tries to negate it by producing symptoms, isn't it? How? The body can throw out a fever, a fatigue, a chilliness, a headache, a lack of appetite, increased thirst, etc. etc. So these symptoms produced by the body is actually the defense of the body, or the effect of the immune status, or the reaction of the immune process towards the organism to get rid of the organism. If the body is in a state or capable enough to raise enough temperature or enough resistance, then that particular fellow doesn't need any medicine. He will recover on his own, it's clear. But when someone is not in a state of good health to raise enough reaction, enough fever, then that particular person needs the help of a medicine. So in homeopathy, what we do is we just augment the reaction of the or the reaction offered by the body to the invading organism. For example, if he produces a fever, if the onset is sudden and there is a redness and there is a splitting headache and the extremities are cold, then that is purely the indication for belladonna. When we give belladonna, what we are doing is we are increasing or enhancing the symptoms, so that when the optimum level reaches, that is why after the homeopathic medicine, mostly in the correct homeopathic prescription, you will see an aggravation where the body tries to bring up the symptoms to such a level where this particular organism fails to survive. It means maintaining an enough temperature for a while will kill the organism, and then the body will be free. So this is the modus operandi of homeopathic medicines, which is in tandem with the body's natural reaction to a stress. So we have to find, this is, and that is why we need to find the exact similimum. So further understanding of things. Now we all know that we come across a lot of symptoms. What do you mean by clarity of symptom? The symptomatology reflects the health of the person. Even in deep pathological states, if someone expresses clear symptom picture, that means he is really healthy and the case is an easy one homeopathically. So you might be thinking deep pathology means difficult case.
Fatima, minde Kannada nokko, Kannada box unda message almarita.
Okay, so even in deep pathological states, if someone expresses clear symptom picture, he is really healthy. So for a homeopath, the difficult case doesn't mean that it is a deep pathology. If in cancer case, if we come across a clear symptomatology, that's an easy case for a homeopath. I will give you an example. This is a case of cancer lung with lung and bone metastasis and is still surviving on homeopathic medicine since 3 years. This is one of my cases. And these were his peculiar symptoms from the vast array of symptoms. I could manage these peculiar symptoms: cough with blood-tinged expectoration, can't lie on left side, which hurts. So aggravation lying on left side and better by lying on right side. And he is very sensitive to cold. There is great thirst and thirst for cold water. And he still decides during this phase of his life He is really craving for ice cream.
Sir, your screen is not visible.
My screen is not visible. Hello? Is it not visible? Hello?
Hello, sir.
My screen is not visible.
No, sir.
I have shared. Okay. Now?
Yes, sir. Now it's visible.
Oh, I'm sorry. So till now it was not visible.
Yes, sir. Till from the previous slide.
Okay. Now it is visible, right?
Yes, sir.
Okay. Is it visible?
Yes, sir. It's visible.
Yeah. Okay. So you can go through this case. It is a blood-tinged expectoration. The aggravation left side and relieved by lying on right side, and he is very sensitive to cold, and he has great desire for icy cold things or ice cream. The case is pretty clear, I think. The phosphorus element was pretty clear, and he was confirmed, and it was confirmed with the psychological essence. And what is the psychological essence of phosphorus? Phosphoruses are really fearful persons. They need assurance. So this particular person was always demanding someone else's presence. So this suggested that the case was psychologically also corresponding to phosphorus, and his symptomatology, the physical symptomatology, also was pointing towards phosphorus. And started with 12 CTDs, now on 30, doing absolutely good after 3 years. So it doesn't bother about the dosing and other things. I was just mentioning how clear symptoms will guide you to the Similimum. But nowadays, the cases are becoming really unclear. Let us come across such a situation. If symptoms are not clear, what does that mean? If there are no clear modalities, desires and devotions not that intense. See, these sort of situations usually happen. If someone reports to you with headache, and if you ask them, where is your headache? Oh, doctor, I can't say where it is located. I can say just it is a vague headache. Okay. And is it radiating to someone somewhere? No, it is not radiating. When it comes and goes, no, I can't say that it is there throughout the day. Is it getting relieved by any means? No, it is not getting relieved by any means. Only if I take some pills, I feel better. So this is a case, or this situation means that it is unclear. The person is not throwing out any clear modalities. That means the person's...
So the slide is not moving, so actually it is not visible.
Oh, so what is happening now? Actually,
So only the first slide is being visible. I mean, I think you should click in that slide so that it will be.
so by pressing on resume share, it is again going back to the mute state. Is it now visible?
Yes, sir, but only the first slide, sir. I think you could try clicking that slides that.
Only the first slide,
slide.
or if symptoms are not clear, that this slide is not visible, right?
No, sir.
Okay.
Yes, so now it is changing actually.
Now you can see.
Yes, sir.
Okay. So if symptoms are not clear, that means there is no clear modalities. Desires and devotions are not that intense. So see, we get clear symptomatology when someone says that I am really desirous for sweets. So I'm totally averse to fat. But instead, if he says that I'm not that particular about food, there is nothing much to be looked into, then the thing will become difficult for you. When there are no other peculiar symptoms, no clear essence, these are difficult cases, or what we say layer cases. Most of you might not be aware of the phenomenon or aware about the concept of layers, right? See, the concept of layers means usually we think that each and every homeopathic case can be cleared by one single remedy. No, it is not. We are in search of the constitutional remedy, right from the day when we joined homeopathic medical colleges. Have you ever found one for yourself? No. Why? Because the constitutions, those are the very, very rare healthy constitutions where we can come across a clear remedy picture in throughout the phases of life. See, for example, if a child is born and showing some symptoms of Calcarea carbonica, and in the adult state also he is Calcarea carbonica, in the old age also he is Calcarea carbonica, then we can say that this particular person is Calcarea carbonica constitution. Instead, what happens nowadays is the Calcarea carbonica state on which he was born later might, due to this different circumstances, situations, for example, if he encounters a great grief within the family, he might slip into a state of natrum muriaticum. Later on, when he encounters some other complications, he might go to a state of tuberculinum. So there are different layers of medicines getting added to the basic layer of Calcarea carbonica. So when we meet that individual, if he is in the state of tuberculinum or showing the symptomatology of tuberculinum, that means the tuberculinum needs to be given first. Then after some time, say 6 months or 7 months, the tubercular layer will be removed, thereby expressing the natrum muriaticum. Then we have to prescribe natrum muriaticum. After some times, means a year or more, the natrum mur picture will be gone. Then we will come to the basic layer of Calcarea carbonica. So this is the concept of layers and how to prescribe on the basis of layers. These are little tougher aspects of homeopathy, and you need greater insight to just don't get confused about all these things. These are a little tougher things. Later you will come to know all these things. So for example, an asthma on inhaler, I will give you a live example. This case reported with, a normal asthma case. He is reporting with the symptoms of breathlessness. He's saying that he's on inhalers twice a day. There is no specific timing as such. And if he is not taking any inhalers, he will wake up with wheeze after a few hours of sleep. These are common symptoms. And he says that there is some aggravation from cold. And he says that I'm comfortable in open air, sitting upright, which is again a common symptom for asthma. Taking warm water, which is quite usual in nowadays scenario. People tend to give warm water and they will feel a kind of relief. And appetite is less, without much of cravings, desire sweets, perspire, much during which he feels worse. So some sort of mild expressions are there which can give you some leads towards a remedy, but the case is not clear. So these are the tougher cases by which you have to be really skillful to find out the moments similimum. I'm saying the word the moment similimum means that is the similimum of the moment. Afterwards, that means after some time or after the medicine you gave have given enough response, then in future you may need a new remedy. So these are the examples. So can I move ahead, or is the time to stop? Hello, someone please.
Hello, sir.
Yes. Is your time up?
No, sir, you can continue.
Okay. I will fastly give examples of 3 homeopathic cases of psoriasis. So you can see this case. The psoriatic lesions on the face and the body since 2 years. Occasional itching is there. And these are the peculiar symptoms by which I prescribe the remedies. Craving for fish and meat, which is meat is 2+. Perspiration increased around neck and back. History of recurrent tonsillitis in the childhood. Thirst increased during night. Cold water. More sensitive to cold. White spots on nails. History of abscesses in the body. Offensive foot sweats. See, this is the case where the symptomatology was very clear. If you look into the symptomatology, there are peculiar symptoms. Thirst increased during night, and that too for cold water. That is a very peculiar thing and a characteristic thing. Offensive foot sweat. Again, it is a very characteristic symptom. See, based on these symptoms and the tendency for abscesses and history of tonsillitis, and he has weak nails and white spots on nails, that means the medicine is clear here. Hope everyone is recognizing silica here. So what makes the best homeopathic? Okay, the silica 10 ml 1 spoon was given, and it was followed by a severe aggravation. And then the complaints got reduced. And this, usually it is said that psoriasis cases are very difficult to cure. Yes, of course it is difficult to cure, but this case cured within a span of almost 3 or 4 months. So after the first medicine, this was the first picture. After the medicine, it became worse like this. There was a severe aggravation, and then he got resolved. This was the transition. Then they finally got resolved. This is the final picture. You can see the marks on his chest, face, but they are only marks. So this was the aggravated phase, then the relieved phase. So this is the transition. Only few of the spots were there in the first picture. Then after he was he has taken silica, the complaints got aggravated really bad. Then it started to resolve, and it finally became like this. So the homeopathic aggravation, just wanted to point out there is a chance of homeopathic aggravation, and homeopathic aggravation is a fact, and homeopathic aggravation happening means your prescription is correct. So inference is this is a classical example of a person who belongs to a good level of health. This is what I would like to share with you. Persons with a good amount of health can throw out clear symptoms. So aggravation followed by amelioration is the ideal scenario to be expected in a homeopathic case. This is an example of constitutional remedy. So if you examine the case right from the beginning, he used to get tonsillitis in the beginning. He has weak nails since the childhood, and he is still having symptoms of silica. He was silica in the childhood. He is still maintaining the silica picture. So till now, he is on the same remedy picture. That means this is his constitutional medicine. This is the concept of constitutional medicine. So in case number 2, I'm just sharing these cases because the strategies of selection of remedies are different in different cases, though it is the same diagnosis. So this is a psoriasis case since 22 years. That itself suggests that it is going to be really tough. Got a very peculiar symptom while taking the case that worms or bugs are constantly moving underneath the skin. More than the actual itch, this particular sensation was the most troublesome thing for him, and the patient was too loquacious. So I was not aware about the medicine, but the sensation of worms or bugs going to the repertory pointed towards cocainum hydrochloric. And the cocainum, so, you might recognize this is cocaine. That means the drug which can stimulate your brains, producing some symptoms. So this particular sensation was there in this remedy, and this remedy actually opened up the case. After cocaine, see, so many homeopathic remedies were prescribed in this case prior to that, not by me, by other homeopaths also. And he was not showing much of an improvement. See, in these cases, the correct sequence of medicine has to be identified. The case was opened with cocaine, but later on, after 2 or 3 months, he was found to be having symptoms with lycopodium. And then the case resolved beautifully and is responding very well now. So inference is that sometimes a peculiar keynote can give us the lead towards Similimum. And I presumed that since he went to many homeopaths, I inferred that most of the polycrest must have been tried upon him, so was eager to give a dose of cocaine. I don't think this is the only remedy. So, okay, the next follow-up is, I have told you that he was given lycopodium and he is responding beautifully. But still, he won't be completely cured with lycopodium also. After say 6 months or 7 months, I expect a change of remedy. So case number 3, while taking a case in a young psoriasis patient, male 36 years, though there were many clear symptoms like craving for meat, thirsty for icy cold things, etc., I came across a very peculiar symptom told by his wife, that he was of late moaning a lot in the sleep. So this suggested me the possibility of an evolutionary pattern. That means of late he's been struggling emotionally, so that the current scenario pointed towards a remedy. Because I knew a remedy out of stress, out of depression, when someone is not able to express it in the daytime, the subconscious mind probably points towards the state. So inquired about any possible mental emotional pathology that might have led to this disease. An industrious, ambitious young man, while he was doing really well in his business, suddenly faced a reversal and got shattered. So that sudden reversal of fortunes made him struggle on his emotions, and ultimately it resulted in this state. So this case was responded to orometallicum 50M. So we have seen 3 different types of psoriasis cases. And what it suggests, the prescription is not based on the diagnosis or the pathological nomenclature. It's all dependent on how one perceives the case, and the case itself manifests by different means in different individuals. How healthy they are. If they are really healthy, they will throw out a clear case. And if they are not healthy, they are not giving you any clear symptoms. But in the meantime, you might come across 1 or 2 very, very strange, peculiar things by which you might be able to open up the case and you might be able to move further. And in the last case, the mental emotional pathology, the mental emotional essence, which has pointed towards the clear picture. So these are the different aspects of homeopathic prescriptions. See, I'm taking more of your time. It's already an hour, I think. If some doubts are there, then I will clarify, or if you need me to continue further, I can continue.
So you can continue for another 5 or 6 minutes.
5 or 6 minutes. Okay, then we will do one thing. We will go for an exercise. Okay.
Yes.
Yeah. See, all of you, please go through this case. I'm giving you an example of case, some details of the case, and please give me the response in the chat box. A 26-year-old female who has been asthmatic since 3 years had recurrent tonsillitis in the infancy, took a lot of antibiotics, and slowly the episodes became less. Then she developed abscesses in the axilla, which has also shown recurrence, got operated twice or thrice. Then during teens, she started to have big acne, again treated aggressively. After her 12th, she was not allowed to pursue her choice of studies. Dissatisfied, she became dissatisfied and then developed asthma. So please, everyone, try to give suggestions for this particular case. Don't be afraid, don't be shy, because this is not your case. You are basing the prescription only on the available data. You are not having any freedom where you can ask the patient or further clarify the details which you are getting now. Or at least you try to point few remedies or a remedy which has a definite predisposition for abscesses. Predisposition for abscesses and tonsillitis. One of the remedy I have told you already in a case before. This particular case, this particular lady is a really egoistic lady who is really headstrong, and he has great importance. That means self-importance is there. Just I want you to study this remedy too, so that later on this will be helpful for you. I'm not giving you easy cases because it is easy to manage also, but the rare, but if I give you a rare remedy, that means not that a frequently indicated remedy for you, you can remember that for long. So let me go to the chat box. No responses as such. Why? Everyone. Bryonia. Platina. The word I have said, headstrong, has prompted Dr. Dhanya to give platina. Yes. Jisha Vinu says that it is Staphylococcus aureus. Staphylococcus aureus. Why Staphylococcus aureus? He was not allowed to pursue her choice of studies, so she is supposing that it is a kind of suppression, right? Staphylococcus aureus. Good. In a way that is a reasonably good way of thinking. Any other answers? Okay. Now, yes, Dr. Roy has pointed bryonia. Why? Bryonia. Can you elaborate why you are suggesting bryonia in this case?
Sir, for asthma, I think bryonia is given.
Asthma? It was not
Bryonia
audible.
is given.
Asthma, for asthma, bryonia is given.
Sir, I think bryonia is
Bryonia is a
dry spasmodic.
yeah, I haven't mentioned anything regarding the dryness, spasmodicity, or anything like this. Okay, Dr. Roy, see, this is one mistake that we usually make. That's why I have given you the paper case and asked to respond. Bryonia for asthma, that is a blind prescription. You need the symptomatology of bryonia to prescribe. And what is the symptomatology of bryonia? Extreme sensitivity to motion, extreme sensitivity to movement, and the dryness with great thirst. And along with that, if the person is insecure regarding finances, then we can prescribe a bryonia. And if the onset is insidious, slow, if he was exposed to cold today and he develops asthma day after tomorrow, then that can be a bryonia case because the onset is slow. So bryonia is ruled out. Dr. Roy, don't be, please don't feel offended. I am just trying to correct you. Okay, the next suggestion given was platinum. Yeah, reasonably good choice because I have mentioned that this particular person is headstrong, haughty. Based on the mental emotional picture of haughtiness, you are prescribing platinum. See, this is one another mistake that we usually do in the beginning of our practice. We get an impression that the person is haughty and we are jumping into the prescription. That doesn't make any sense. You are not sure. For a person, or in this case, if you have to give platina, the reason behind the haughtiness need to be explored. So I have told you that this particular lady who actually had strong wishes about herself, and she was actually in that aspect only strong. And what is platina? Platina always shows great contempt towards the fellow people. That she herself is somebody who is really great and the others are inferior to them. That is the feeling of platina. Of course, and the other physical things mentioned in the case doesn't likely represent a platina pathology because there are a lot of abscesses, tonsillitis, abscesses, etc., etc. So that is one way of thinking. So it is definitely not platina. Yeah, and another good possibility which you have mentioned is Staphylococcus aureus. I think the doctors who have suggested Staphylococcus aureus is mentioning Staphylococcus aureus simply because she was refused to pursue her studies, and in a way that it is a suppression. Yes, Staphylococcus aureus we give for suppressions, but you have to get a feel how the suppression affects the body or how the suppression has affected the body. In a classical Staphylococcus aureus case, when the person is suppressed, he or she has to throw out the symptomatology of Staphylococcus aureus. And what is the symptomatology of Staphylococcus aureus by which we usually confirm a state of Staphylococcus aureus? The person will become, classically, the person will become suppressed. And what is the reaction? He or she will fail to react. Or he or she doesn't have the basic courage to react. Inability to react. Professor Vidulka says a beautiful phrase about Staphylococcus aureus, that a Staphylococcus aureus usually swallows the indignation without giving any impression that she is affected. A wife who is Staphylococcus aureus suffers a lot of torture from the husband, and the wife, she will silently suffer all the emotions, and she will do all the responsibilities she has to do for the husband. But deep inside her, she feels suppressed, but she is not expressing her anger. This is the Staphylococcus aureus state. And the Staphylococcus aureus, we usually confirm it by two important symptoms. Please everyone note it down. The siesta aggravation. If you see a history of suppression and if you ask them how you feel after an afternoon nap, and if they say that I am terrible, doctor, after the nap, if I take it in the afternoon, then that is the greatest indication for staph aureus. And along with that, if you come across history of sty in the eyes, then the case is sealed. So in a way, the abscesses, the staph aureus throws out painful tumors. So, as you have mentioned, this was the closest of the suggestions. But I would like to invite your attention towards the remedies which can produce abscesses. Of course, the basic thing or the first remedy, as you all know, is silica. The next one is HEPA sulfuric. The other thing is mercury. But then what we have to do? We have to differentiate these remedies. For HEPA sulfuricum, you need extreme sensitivity to cold. And HEPA sulf is really abusive. And silica, what you need? I have mentioned the other case. You know, by offensive foot sweat, the nail bed infections, the history of tonsillitis, the yielding nature, etc., etc. And what we need for mercury to be our remedy: offensive breath with profuse salivation, salivation during sleep, and there is a peculiar metallic taste. So this is the way how we need to differentiate remedies when we get a case. So coming to the case, see, this is an individual, a lady who had a lot of acne, discharging acne, and history of abscesses. A very strong personality, egoistic personality. And she was, so for an egoistic personality, if someone hurts that ego, that itself is a trigger for her health to go down. And this is the case where we see such a response in a medicine, and which is a rare remedy to be given, Calcarea sulfurica. So the remedy prescribed was Calcarea sulf, which has features of Calcarea and sulfur, but it together makes a beautiful remedy which has its own keynotes. We usually confirm Calcarea sulfurica by asking one single question: does she have desire for sour, unripe fruits? A person with acne, discharging pus, if she has great desire for sour, unripe fruits, and that is a clear case for Calcarea sulfurica. Another strong remedy which has great desire for sour, unripe fruits is Medorinum, but the pathology is different. So this is how we have to solve paper cases. So I think it is time to wind up. If someone has questions, then I think we can go for it. In the meantime, we can clarify some of your doubts. So it was actually nice talking to you. I think we can meet again for discussing such cases. And
Thank you.
Yes.
Thank you, sir, for the valuable lecture of the Similimum in homeopathy.
Yes.
And now is the time for queries. Participants who wish to ask questions to sir can please type in the chat box or raise the hands. Or
I am audible, sir.
Yes, Dr. Anand, please.
Good afternoon, sir.
Yeah,
It is
very
a
good
very
afternoon.
wonderful session, very informative.
Thank you, doctor.
Can you tell me about you have, sir, 1 spoon of
Okay,
silica 50 m. How to
okay, okay.
give, how to
Okay.
repetition?
Yeah, the repetition and the other things. See, see, in that case, it was psoriasis. Okay, and we have selected a high potency. Since I was very sure about the medicine, I went for the highest potency. This is what Mithunka says. If you are really sure about the medicine, and if you feel that the constitution has enough, is very strong to accommodate a high potency, you can go for a high potency. But if prescribing a high potency, and if we prescribe the dose fully, the chances of aggravation was really bad. Of course, there was a big aggravation after the medicine. I usually try to reduce the aggravation by again reducing the quantity. That is why I used to dissolve the potency in half glass of water and ask the patient to take only 1 spoon. This was the dosage given, and thereafter no medicine was given, only placebo. So there was no question of repetition in that case. Repetition comes when there is a relapse of the situation. In a strong constitution, or a person who is having a very good health, seldom we need a repetition. In other cases, the selection of the remedy or the remedy might get antidoted very fast. Then thereby, if a proper relapse happens, then we have to repeat the medicine in the same potency, or we have to try the next level of potency.
Sir, whether you use 50 m in a globules or drop?
Of course. No. Whether it is in globule or whether it is in drop. If it is in globule, take 1 globule, dissolve in half glass of water, give 1 spoon.
Hello, sir.
Yes.
So we have one more question in chat box about repetition of remedies in psoriasis cases.
Okay, generally about the repetition of medicines in the psoriasis cases. See, doctor, this is what I'm trying to say right from the beginning itself. There is no psoriasis case for homeopathy. Homeopathic case means we cannot say it is a psoriasis case. The repetition of medicine depends on the health of the person or the susceptibility of the person. If the person is really healthy, he might not need repetition. If the case is really weak, then we tend to prescribe really low, 6C, 12C, or 30C in the beginning. See, our purpose is to initiate a response. So, if we prescribe, if for example, it is in a really bad state of health, if the person is in a really bad state of health, then we tend to prescribe really low. Suppose I prescribe 30. I prescribe a dose of 30, or I try to repeat 30 for 3 consecutive days till I see a response. If I come across a response, be it an aggravation or amelioration, I will stop. Then wait. Then there is no need for repetition. Then wait till how far the response continues. If it is aggravation, aggravation should follow by an amelioration. Or if it is an amelioration, it can be either due to the bad health of the person, or due to a similar remedy, not Similimum. Then what happens is, after some time of amelioration, the things will relapse. And based on the, and during that relapse, you try to repeat it once again. And if it continues to happen like this, most probably the medicine will be wrong. Go for a better selection of medicine. So this is my take on repetition of medicines. Otherwise, you don't repeat. The criteria for repetition in any case, not only psoriasis case, is the symptomatology. How the symptom relapses. Till you get a complete relapse, please never repeat. It is usually seen that when we see a slight relapse, people repeat the medicine, and then that will end up in a huge aggravation. It is better to have a wait. Most probably these small relapses will go on its own, and then we have to wait for the next set of symptoms to appear. If this next set of symptoms appearing is in the same pattern of the prescribed remedy, then we have to prescribe the same medicine. Or if there is a great change in symptomatology which points towards a new remedy, then you have to try the new remedy.
Good evening, everyone. On behalf of all, I would like to thank Dr. Vinod Joseph for his wonderful talk on the topic, how to become effective in choosing Similimum. Sir, it was really useful for us students. It reminded us not to be biased about particular remedies and also to inquire the reason before selecting each remedy. For example, especially the mental symptoms, we are supposed to know the reason and how it is producing a disease. It was really useful for us, sir. And also it gave us an important idea on how to choose a constitutional remedy too. It was really useful for us students, sir. And I'm sure it will be helpful in future. I would also like to thank all the participants for attending this session. Last but not the least, I would like to thank the coordinators of Ifph for conducting such wonderful sessions for us each week. Sir, we also look forward to hear more sessions from you. Once again, thank you, sir.
Thank you. Thank you all. Have a nice week.
Thanks a lot.